that you will be needing. Pahiram ng speed mo manometer. Sino may speed mo dyan? Speed mo. Dyan ka na. Ito. Ito.
Lucky.
Okay. So what are these materials that you will be needing for this assessment? You will be bakit natin kailangan i-prepare muna yung sphygmomanometer before the procedure? So you have to know the rationale. In most of the steps that you are going to perform, there are rationale. Ito yung mga reasons bakit ginagawa natin yung procedures na yon. Okay, what is the reason or the rationale? It will save time and energy on the part of you as caregivers when taking the vital signs. Kasi pag babalik-balik kayo, halimbawa, kinuha niyo muna yung temperature niya, o bumalik na naman kayo, kumuha kayo ng sphygmomanometer. So it may entail a lot of energy on your part as caregivers. So para mas mabilis yung pagkuha natin, i-prepare na muna natin yung mga gamit. And what are these materials that you will be needing? Thermometer.
Speedometer.
Okay. So on your assessment, you have to show me what the thermometer is. Kasi ito, medyo madali-dali pa yung mga equipment. Sa iba kasi, napakarami niyan. So, you have to know the names of each equipment. Kasi during your assessment and test, may mga equipment din silang tinatanong kung anong pangalan nun. And some of them could not be answered by the students. So, you will be needing a thermometer. Sphygmomanometer. Nasaan yung sphygmomanometer dito? Nasa dito. Ito, yung mismo kukuha ng blood pressure, no? Ito, anong tawag dito? Stethoscope. Okay, so you'll be using a sphygmomanometer and a stethoscope. Ano pa? O, cotton balls. Alcohol. O, kung may alcohol na to, pwede rin. They should be soaked in alcohol. These are your medicine glasses. Yung kulay silver na yon. Then, you will be needing a watch. Bakit nyo kailangan ng watch? With seconds. Ha? Oo, kasi kumukuha tayo sa loob ng 1 minuto. No? So, kailangan natin tignan yung relo natin. It should be about 1 minute. Yung mga walang relo, cellphone, pwede na. Okay. Yung may timer. Then, a small notebook and pen. Why do you need a small notebook and pen? Okay, isusulat nyo doon yung mga results ng nakuha ninyong vital signs sa patient. Okay, so those are all the materials that you will be needing for this procedure. Next. After the preparation of materials, in most assessment that you will be performing, or lahat, halos lahat yata, no? You have to wash your hands before performing the procedure. Wash your hands before and after. Okay. So, wash your hands before the procedure for infection control. Kasi hahawak kayo ng pasyente, no? Magkakaroon kayo ng contact with your patient. So, in order to prevent contamination between you and your patient, you have to wash your hands. Kasi baka may mikrobyo kang madala sa pasyente mo. Pag pasyente yan, mahina ang resistensya nila, may sakit. So, mas madali silang maghawa ng sakit. For infection control, you have to wash your hands. Okay, the third is check the patient's chart. Anong check natin doon sa chart ng pasyente?
Age.
Anong ibig sabihin ng record?
Information set.
Ha? Alin?
Baseline.
Anong tawag natin doon?
Baseline.
Baseline. No? Para may makukumpara ka. Di ba sabi natin, especially in blood pressure, kung alam mo yung kanyang blood pressure, halimbawa, 90/60 lang, tapos ginawa mo 160 yun, masyadong masakit. So, alam mo na ngayon, saan ka magbe-base. So, you have to check the chart for the baseline of your patients, yung kanyang previous vital signs. Then, nandito ako sa nurse station. Siyempre, sinecheck ko yung chart niya. Tinignan ko yung vital sign niya. Dadalhin ko na ngayon. Nandito pala yan. Sorry. Nandito yan. Nandito pa ako sa nurse station. No? Dito ko prepare yung mga gamit ko. Yan. Nandyan lahat ang gamit ko. Chinyek ko yung kanyang chart. Nagwash ako ng hands. Chinyek ko yung chart niya. So, after nagawa ko na yon, dadalhin ko na yung gamit dun sa room ng pasyente. Kunwari, pumatok na ako. So, before entering the room of your patient, make sure that you have to knock on the door in order to show respect to your patient. Hindi basta yung pumapasok kayo dun sa kwarto ng pasyente when taking up the vital sign of the patient. Okay, so halimbawa, pumasok na ako, I'll be identifying the patient. What is the correct procedure in the identification of patients? Okay, so you have to ask the patient her name is, what her name is. So, kung tama yung ibibigkas niya, then you have the correct patient. Hindi yung pwedeng sabihin mong, kasi ang pinito mo? Miss Liko. Sabihin mo, ay Miss Liko, good morning. Nakahiga si Miss Liko dito sa bed, no? Kaya pala yung sister niya yung nakahiga sa bed. Ay yes, sabi niya. Sa palang pasyente, nasa CR. So, you have to be sure. Kasi, halimbawa, kaka-admit lang yan. Hindi pa naman kilala eh. Di bale, kung ilang araw na yung nandyan, kilala mo na yung pagmumukha niya. Pero kung kaka-admit lang niya, syempre you have to identify correctly who your patient is para hindi ka magkamali. Mabuti kung vital signs lang ang kukunin mo. Kung kinuhanan mo siya ng ginawa mo siya ng ibang procedure. For example, inugasan mo yung quit niya. Ginawa pala siya yun. Dapat tama ang pasyente. Dapat tama yung ating pasyente. So you have to identify correctly the patient. And another thing, pag naka-admit yung pasyente, ano makikita mo rito?
Yung
tag niya, yung identification tag or band. So yun, sigurado. So yun. Okay. Next, assess the patient's readiness for the procedure and identify factors that may alter vital sign checking result. Anong ibig sabihin nun? Explain nyo nga muna sa akin yun. Ano yun? Identify the patient's readiness for the procedure and identify factors that may alter vital sign checking result.
check sir, baka mamaya nag-exercise siya o kaya naglakad muna.
Okay, so yun yung a-assess natin, no? Titignan daw natin kung pwede na siya doon sa procedure na yon. First, tanong mo, nagkape po ba kayo? Kasi breakfast mo kukunin. Anong magiging problema pag nagkape siya?
Mabilis ang tibok.
Maraming pwedeng mangyari dyan. Yung kape, mainit.
Body temperature.
Inom niya yan, kinuha mo ng oral temperature. Anong pwedeng mangyari? Pwedeng tumakas yung body temperature niya. Ano pa ang kape? Ang kape? Ano yun?
Nakakabilis na
pwedeng tumakas.
Nakakapalpitate.
Nakakapag-palpitate yan.
Palpitate.
So, pwede siya magka-palpitation, mabilis ngayon yung tibok ng puso niya. So, hindi na naman accurate kung pwede mong makuha. Pwede rin daw siyang makapagtaas ng blood pressure, yung caffeine. No? So, kailangan assess mo muna. Maliban sa kape, ano pa yung assess natin? Kung halimbawa, merienda naman.
Food intake.
Ha?
Food intake, sir.
Anong food kaya? Merienda.
Spaghetti.
Baka nag-ice cream siya, no? Merienda siya, nag-halo-halo, dinala siya ng halo-halo. Okay, so, malamig naman, mababa naman ang makukuha mo vital sign. O yung sinabi naman ni Mama Kaalali kanina, baka naglakad daw siya sa labas. O, tingnan muna natin. How many minutes are we going to make?
30.
20 to 30 minutes. The same with temperature. Ganun din yun. 20 to 30 minutes para mag-normalize lahat ng condition ng katawan niya. So you have to identify those factors. Baka kasi biglang sabihin mo, ay, bilang na itong pasyente ko, nakainom pa lang pala niyang kape, or kahigop lang niya ng instant mami. No? Siyempre, mataas ang kanyang temperature. So you have to identify first those factors. And next, explain the procedure to your patient. Miss Likup, I'll be getting your vital signs. No? So explain mo. I'll be getting your temperature and your blood pressure. Normally, yun kasing gusto nila, yung blood pressure. No? Pero huwag mong sasabihin, kukuhanan mo siya ng vital sign. Ay, ano yun? Sabi niya. Hindi niyo maintindihan kung ano yung vital sign. Pero kung sinabi mo, kukuhanan mo siya ng presyon, gustong-gusto ng pasyente yun. Yung pinukuhanan siya ng presyon. No? Huwag lang paulit-ulit. Mahihirap tayo.
Pirated sa tumatalon.
Next. Be sure that the room lighting is adequate. Bakit? Dapat daw maliwanag.
Para makita yung
Just
temperature.
like in medicine na na-discuss natin yung sa safety, kailangan mabasa mo accurately yung temperature, tsaka yung blood pressure niya, at saka yung respiration, at saka yung kanyang pulse. Kasi titignan mo, baka mali pala yung pag-ikot dahil medyo madilim. So there should be an adequate lighting. And assist the patient in a comfortable position. Saan ba siya komportable? Okay lang ba siya sa kanya na nakahiga? No? Or nakaupo? So ask the patient if she is comfortable enough before taking the blood pressure. Okay, yun na yun. Tapos na yun. So next, introduction pa lang yun, no? Now, you have to proceed in your blood pressure measurement.
Sabit.
First is to get the temperature of the patient. That will be the first vital sign that you will be getting. So take the thermometer out of its container. Disinfect the thermometer using cotton balls soaked with alcohol. From the bulb, alam niyo na yung bulb ng thermometer, from the bulb to the stem, using one firm rotary motion. Okay, so if you have already cleaned the thermometer, do not
Touch.
hold the bulb. Baka ganyanin nyo na naman to. So hanggang dyan lang yan. Discard the used cotton ball on an empty container or medicine glass. Check if the temperature at eye level, if it is 35 degrees or below. If it is not, then hold the tip of the stem using your three fingers, the thumb, the index, at saka yung middle, no? And shake down, jerk it down in order to bring the temperature below 35 degrees Celsius.
John.
If ever yan, 35 degrees Celsius na yan, what are you going to do? Insert it
You remember?
on the axilla of the patient. Okay? And tell her, no? Anong tawag doon? To put her arm against that side of the chest para hindi mahulog yung thermometer. Okay, how many minutes will you wait?
A minute.
1 to 3. 1 to 3 minutes.
A minute.
3 to 5 minutes. Normal 1 to 3 minutes na. 3 to 5 minutes.
Axillary yan, no?
5 to 7.
While waiting now, while waiting for that time to lapse, you can proceed with the other vital sign. Ano yung vital sign na yun na susunod ninyo?
Pulse.
Pulse.
Okay, pulse rate. you will be getting the radial pulse of the patient by using your two fingers, the index and the middle, and put your fingers on the thumb side of the wrist in order for you to count
Downside of the wrist.
for the pulse rate. So, check. O, pwede mo rin ganyanin yung kamay niya against the chest or maybe the abdomen kung nakahiga. O, so, halimbawa, yan, sa chest. Bibilangin mo ngayon ng 1 minuto. You're going to count in 1 full minute the pulse rate of the patient. And after you are finished with the 1 minute pulse rate, you proceed to the next vital sign without removing your fingers from the patient's wrist. Bakit? Anong sabi natin yung isang araw?
Makakontrol nila.
Okay, in order for you to check for the respiration of the patient without her knowing that you are taking her respiration. Okay? So, nandyan pa rin. Tapos na ipakuha mo ng pulse rate. Susunod na ngayon. Bibilangin mo ngayon yung rise and fall ng kanyang chest. Sabi natin, 1 rise and fall is 1 cycle. So, yun yung bibilangin natin. Okay? 1 minute na naman yon. So, after 1 minute, yan, tanggalin mo na yan. Alam mo na yung kanyang, alam mo na yung pulse rate niya, alam mo na yung respirations niya. You're going to proceed with the next vital sign, which is the blood pressure. So you're going to get the blood pressure. Marunong na kayong kumuha, di ba? Stop. Make sure that the cuff is appropriate for your patient, and it should not be too tight nor too loose by checking if your two fingers can easily be placed under the cuff. Okay. Next, so alam niyo yung procedure na to. Yun yung kahapon. Close the valve. And it will be better if the manometer will be at the level of the heart of the patient. No? At heart's level lang dapat parati yung manometer. So, check. Check na natin by placing the diaphragm on the brachial artery of the patient. So, lalagay mo yan. Close the valve. Inflate. So, yung first sound na maririnig mo will be her
Systolic.
systolic, and the last sound is the diastolic. Halimbawa, nakuha mo na. So, remove the cuff from the patient's arm. So, tapos na yung time dun sa ating thermometer. You're going to check the temperature reading. Get the thermometer from the armpit of the patient. Read at eye level. Basahin ninyo. After reading, disinfect again the thermometer. This time, from the bulb, from the stem. Ito yung stem niya, the tip of the stem. Going to the bulb on one firm rotary motion. Discard your cotton ball. Place back the thermometer on its container. Yan. Do your aftercare, ligpit mo kung may marumi dyan, then magpaalam na dun sa pasyente. So, anong gagawin mo ngayon? Pupunta ka sa nurse station, Paalam ka na, ngayon mo re-record. So, kailangan natatandaan mo yung mga vital sign na kinuha mo. Okay? So, tandaan nyo yung mga vital signs. Yung pagkatapos natin kuhanin lahat ng vital sign, doon natin nire-record. Kasi alam na alam ng pasyente na hindi mo kabisado yung mga kinukuha mong vital signs sa kanya. Pag halimbawa, kuha mo yung pulse, kuha mo yung respiration, sulat, kuha yung vital signs, ay yung blood pressure. So dapat, alam mo lahat, may kabisaduhin mo. So, kabisa assessment nyo, gano'n, kabisaduhin nyo. Yung mga makukuha nyo dun sa partner. Okay, for this assessment, may partner kayo. Pumili kayo ng partner nyo. By twos.
Stop na.
Kukuhanin nyo ng vital sign